Okay, so let's dive right in. We're here to have a discussion around loss and what that means within the reproductive health journey. And as we know, loss is such a broad term. It can mean so many things to those who undergo this during this special window of time. It can mean an early miscarriage. It can mean a late pregnancy loss, a stillbirth. For some, it might mean an embryo transfer that didn't take, or a retrieval that didn't result in any eggs. It could be a combination of any of these, or recurrency for any one individual. And what we're here to talk about today is the fact that everybody experiences this loss in whatever way that in whatever the way the event shows up, in a very different way. And so therefore their needs are going to look very differently. So how do we as individual providers show up and provide that care? And how do we do that in a collaborative setting too? And I'm just so happy to be having this conversation with all of you who lend such important and unique lenses to this space, from being a midwife to mental health therapist, pelvic floor physical therapy, and I'll touch on Chinese medicine as well and how I support in that way. And then when we bring these perspectives together, how powerful that is, and more importantly, how it just creates this care that is so deserving and necessary for people who are undergoing loss. So I would love to hear from each of you and your perspectives. We work as a team at Akin, so that means that we believe in and we practice collaborative care. So any of the patients that come to see you are very likely seeing another person on the team in order to really receive this whole person care and to be supported emotionally, physically, and mentally. And that certainly includes loss. And just to really call out that when loss occurs, it's not a stop in care. It's actually this very important point of space and time of the care, not only continuing, but really being supported in a very special way. So I would love to start off by asking Haley, as our midwife, I'd love to hear your perspective on what you know of in the space, if there is such a thing, of what happens when somebody undergoes loss in, say, a traditional healthcare system, versus if somebody who you work with, as more often than not, your journey, your relationship with your patients starts in pregnancy, and what that looks like if that should happen, both as a midwife and somebody who works in a collaborative environment.
Yeah. So as a primary healthcare provider for pregnant folks, I often am contacted in that early, 5 to 6 week window of like, hey, I just found out I'm pregnant, and and the stats are that 1 in 4 pregnancies, can end in miscarriage, and so we start our care, and it can be kind of often, especially if in sort of seasons of time that it may end in a miscarriage. And I think the conventional way of thinking, because of the way that people have interacted with the medical system, is that like, okay, well, bummer, I'll contact you next time, and thinking that there's a full stop. And in fact, it's really different with midwifery care. Traditionally in the medical system, one would be told maybe just to go to the ER, and wait there, and or be seen by a provider after many hours of bleeding, depending on where you're at in the pregnancy, and and without a lot of follow-up or a lot of care to then what happens in that healing process, but then also in the journey of becoming pregnant again. And so when you're working with a midwife and a little bit more of an integrative, holistic approach and model of care, you are treated as postpartum. And so you will be given once the loss happens and leading up to that, there's a lot of communication with the midwife, and as far as like how much bleeding is too much bleeding, when should you now, seek out um, more medical care, and what to do to kind of heal in right afterwards, of like nutrition, physically, emotionally, how to set up a support system for yourself in that immediate postpartum. Um, and what does that look like in that space between the next pregnancy as well, with whether it could be drawing labs together and seeing what your progesterone levels are, or suggesting other remedies to kind of boost your cycles. It's someone to kind of walk hand in hand with you on this journey, so you're not feeling like this is something to be isolated, by. And it's unfortunately a really, like, the worst sort of club to be a part of, but it is a club, it's a collective experience. And so knowing that it's not your fault and not something that you did or didn't do, but that there's context for what happened and what is currently happening to your body, and how then to, um, take care of yourself and nurture yourself in that time. And so um, working in, within Akin, and being able to hand you off to the other providers of mental health and pelvic floor physical therapy and acupuncture, all of these things to help address the physical and emotional um, physical event that you just went through, and to kind of keep going, is really, really vital for your health. And
Yeah.
so yeah, I had a client who had multiple miscarriages, and one was in one of the miscarriages was in the second trimester with twins. And so she had a full, birth and postpartum recovery. And she really felt like, people who birth loss deserve the same respect, honor, and support as people who birth life. And so there can be this rush to, for people around you to kind of just think about like the next pregnancy, and at least you got that far, and to find the silver lining. And it's not always appropriate. And so, and even medical care providers do it too, just as in their own discomfort around grief. And I feel like Kristen can speak to that, more, but having a medical provider that's okay sitting with you in that grief, and also kind of giving you ways of permission to feel all of that, and continue to heal, is really, really helpful.
It's so important. Yeah, there is such this like lack of inclusivity of the healthcare system. Like you said, it's a stop point, versus what you mentioned is so powerful, that it's this continuity of care. And that, yeah, like it's in our healthcare system, it's in our support systems, unfortunately, are in our social and cultural norms of, yeah, just like centering these comments around like the next thing, or like because of the discomfort that everybody's feeling with this grief. And it is such a nice segue actually into Kristen, because you do that, you work in that space so beautifully and lean into it with your clients, but also outside of the clients, right? Because you talk about this grief being so scary to hold, when in fact it's like, it's this not opportunity, but I think you mentioned it as like an honor to work with somebody who has touched something that maybe other people haven't, and that's in it of itself a gift. And I want you to speak more to it, because I'm probably butchering it, but yeah, just to speak to how your approach with grief and how you work with patients around this.
Yeah, thanks. I mean, I think you were going in the right direction. I mean, this feeling of like, Haley, also what you said about, can we honor loss instead of just honoring also when there's like a live birth, and that really when someone touches loss, they're touching life, like in just this really raw, deep way. And so as someone like, whether you're a support person or a practitioner that's supporting someone who's going through loss, I think like holding the frame, and it doesn't necessarily have to be said, but like looking at this person and thinking like, wow, like you're going through a sacred time, you know something about life that you probably maybe didn't before, or that you know again, for people who touch it multiple times. And yeah, and like I think the honor comes from the fact that loss and death and grief will touch all of us in different ways, but it touches some people a lot sooner and a lot more frequently. And so it can feel so unfair, and it is unfair in the grand scheme of things. And I think that we can look to these people as like really just kind of going through a holy time.
Mm.
And so in that frame of like really holding them, that they are special, that they have, you know, they are like living life in this really, like I said, kind of raw way. And I mean, what you said, Haley, about the silver lining, I think the thing about a silver lining is that no one can give you the silver lining. The silver lining comes from you. So like, that's the same with feeling grateful for something. Like the moment support people try to like, yeah, move on to the next thing, or like, wow, you got this far, or this is like great, and da 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 da, like it's all well intended, and it can kind of be like a slap. You know, it's like, because it's totally passing over the fact that I'm grieving, or at least like I'm feeling into loss or sadness, and or that I think with pregnancy loss, something I've seen is that it also can just trigger past grief. Like some people may not be like in an intense grief about the miscarriage or abortion that they've gone through or on their fertility journey, but actually it's like bringing up all this other loss. And so then it's like, oh, wow, there's so much here. And thinking about the womb as a container and like what it holds and what it releases. And I don't know, it makes me curious, because I know Tia, I mean, works with the body in that way, and, you know, probably can really say something more to that. But yeah, I mean, there's just so much that comes up. So I think as a support person and as a provider, really tolerating our own discomfort with grief and changing our orientation to it, is that it's not something to like skip over. It's not something to quiet or to like make pretty and like give a tissue and wipe it up. It's ugly, it's raw. And I think as much as we can kind of like reflect that in a, you know, since we're all professionals, in a professional way, but of like really like feeling it, like wincing and, you know, just reflecting the pain that you see in someone's face. And then from there, when the like the feelings have been validated, like, okay, so like, where do we go and how do we go? And because grief does move forward, but you can't skip the the kind of like raw, scary part first.
No. And I love the permission that you give your patients around this whole, we just posted this on Instagram, a quote from you around how often, like, why is it human nature for somebody undergoing loss to put even more pressure on themselves to say, I'm trying to be grateful, you know, for the experience, and I'm going to try again. You know, they instantly, they throw themselves into this responsibility of being something, and then the way that you work is to allow them that permission, like, no, you're not supposed to be anything but what you are feeling. And how quickly we're doing this for other people, and it's
almost like other people, the like social network and support you have need the like training and the tools of how to support you. And it's like you said, it's well intended, but we're so lacking in the education and language around loss. And so I almost feel like this talk is also for not just the person going through it, but for the other people in their life. So it's not just on the person, you know, who's experiencing loss to have the burden and responsibility of like, you know, educating and informing how best to support them, but actually it's for everyone else to do that work for them.
Yeah.
In case they go through it too at one point, you know, and in any capacity of grief and loss.
Yeah, I mean, there's just so much filtering that you have to do out of everything. And it makes me so sad every time I hear someone that I'm working with, like, touch their grief and then immediately be like, but I am grateful for being a mom. Like, of course you are. Like, no, who's questioning that? Like, not me, but I think it's like this, like, oh my God, I don't want to be seen as like not grateful for what I have. And it's just, very damaging.
Yeah.
And it definitely, I don't think it comes from within. I think that is something that like we're kind of like eating from culture and different things, and then has to just be like constantly filtered out.
Yeah. I want to talk about like the different way that, there's the events of the loss, but also like what it means to somebody, which you talk a lot about, Kristen, but it kind of weaves really nicely into Tia. Like it's more than the loss itself. Often it can be a loss of a dream. It can be a loss of trust in the body and confidence. And Tia, the work that you do, as a pelvic floor physical therapist, often people, and you do a lot of physical work with your patients, but it's a much deeper layer when you're looking at loss with you and how you work in this somatic way. So if you can speak to that, that would be great.
Yeah. A lot of the times when I do see patients who come to me, it could be for various reasons, whether it's like pelvic pain or if they are, I also do Mercier therapy, so which is just a manual therapy based approach to address mechanical infertility. And so I'll see patients who are, about to go through a retrieval, cycle or IVF cycle, and they want to prepare their body, beforehand. And they give me like a couple of weeks, but then, they've had this history of loss or like unsuccessful, egg retrievals, or they're dealing with pelvic pain, or it could be like a slew of other different things. And so, the loss that they might have had is maybe it's been weeks or it's been months or it's been years. And they've been holding that in for such a long time. And just like so much to what, Kristen and Haley have spoken about, that there is this approach that unfortunately a lot of them will take of just moving on and moving forward and moving to the next approach and moving to the next thing, without really being able to kind of sit in their grief. And very much to like what, Kristen was saying, that it is a very special time. It is a very holy time, to be in. And it requires you to really be in touch with your body as well. And for those who have gone through a loss, especially if it's their first one, and there's this huge distress, it's like, I thought this was going to be easy. I thought, I wouldn't have any issues. I didn't think that I would be one of the statistics of the 1 in 4. And so there's definitely a huge amount of mistrust, of fear around their body as well too, of like, what if this happens again? I don't trust my body. It was supposed to maintain this healthy pregnancy and it didn't do that. And then from that mistrust and that fear, then there's that disconnection that's there. And I think it makes it really, really hard if that person is then looking to try to achieve, future conception, pregnancy in the future, if there is that lack of trust, of listening, of connecting with the body. And I think it's okay to have like a healthy fear, but then it's not something where you want to then just avoid, and just kind of wish and pray and hope, that things will work out. It does require you, just like in how the grief process, it requires you to really go deep, and it really requires you to go through that process. Is going to be the same thing with the body. It's going to require you to like things that may have been really hidden, or buried deep inside the body, to allow a lot of that stuff to be uncovered. I will speak just like from my own personal experience, from having gone through my own loss at 20 weeks and not having really adjusted and uncovered it, and having it manifest into like pelvic pain, which I still, go in and out of, every once in a while. And it's been 10 years, of that. And so that, that's one example, but that will definitely show up in lots of different ways. And so as a pelvic, health physical therapist, one of the things that I'm doing is like, yes, I'm working physically with them, but I'm helping reteach them how to connect with their body. I'm helping them to feel connection, with their womb, with their belly, just even by placing hands there. And especially depending on, what the level of trauma was, whether, it was just a DNC, or if they've had, a stillbirth and maybe like a C-section, from it. And there's like, where I've had, some patients just not even want to look at that part of their body, or not look at the scar, or not touch the scar. And it requires you to be able to really look, just in the same way of, looking at your grief, and also looking at your body and being able to touch it. And that's how you allow for healing. It's going to be a slow process. It's not going to be an easy, quick fix. Like I think a lot of, Western medicine is like, let's go just, see a reproductive endocrinologist and go through the process of like forcing and pushing, conception, and which I think can be helpful for sure. But I think that the body needs to be in a place of balance. It needs to be in a place of peace before trying to, then go, that route. So that's my intention. That's my hope, when I'm working with patients. And a lot of it, some of it could be very, very scary, and it might not be like actually touching. It might be just like, okay, let's just start with movement. Let's just start with like moving your pelvis, especially, when someone has gone through grief, and that type of loss, like just, a locking, almost like a stiffness that's present. And that will manifest, whether it's like up through the spine, they're having like low back pain, or then they're having issues, in their hips. But then there's just like that level of stiffness or restriction that's there. And like, let's just start with like some movement. Let's just get your body moving again, in a gentle way. But also, like, I want to honor that how people process their grief is going to be very different. And so for some, they might want to just, just lay still and just, cry and have their hands on their belly. And for others, it might be like, they want to run, they want to they just want to be able to run and just cry and be able to process in that way. And so honoring like that, the physically how you move and heal through the grief. It doesn't have to just be like a meditative state where you're just doing yoga and breathing, but it could also be just running. It could be like, that's the way that they need to kind of get that out. And I think that's important, to be able to find a way to be able to release that and having that let go in some way, whatever way that works for them. So.
Wow.
And as a midwife, I've seen, if someone has been able to like override their processing and their grieving of the loss, and they able to get to birth, I have seen the ways in which it shows up. It stays in your body, and especially in a time in which you are opening up to let another person through, it comes up. And and the way this comes up is either like stalling in labor, but mostly it's this distrust in the body, of why is this happening to me, versus in labor, especially if it's unmedicated and seeking a vaginal birth, where the language we use is like, you're working with your body, you're in harmony with your body and your contractions, and it's the power of you. It's nothing, is you're not like a victim of this experience. But when there has been trauma and grief that hasn't been processed, it all comes up then. And so, it is so, and that's to then deal with the physical, even, a lot of physical discomfort in that time, and emotional stuff that you can't obviously process in that moment with all the chemicals and hormones of labor at play, that can then lead to a pretty heavy postpartum, to unpack a lot of stuff. And so it's so wonderful to hear how you can help, address that physically in those early days of grieving and processing, so that, and it may come up again in the birth, even if you've done that work, but it will be less of this roaring tiger, and more something that you recognize and you see, and you potentially have some, tools, especially with if working, with a mental health therapist like Kristen, then like to kind of keep things a little bit more tame. But yeah, it's such important work, Tia, of that kind of physical connection, reconnection to your body and that part of your body.
No, definitely. It is. No, it's huge. I mean, speaking of like, just like how labor will stall, and which I haven't been present, with any births, but just hearing even birth stories, after I see them in postpartum, yeah, and just like whether it's like the level of tearing, that will occur, or the amount of time that they've spent in pushing, because there's just so much tightness, in their pelvic floor muscles, and which is understandable because there was that fear, there was that anxiety of like wanting to hold on to that pregnancy. And so that mental capacity of wanting to hold on, but also even physically, like how much tightness and not allowing yourself to, or allowing their body to be just like supple and, loose and relaxed, to allow that process to, unfold, and wanting to just like hold on, for dear life. And that will show up and, can then, cause a lot of, issues postpartum, which, yes, I could see definitely how that can lead to like postpartum depression, and, even bringing up past griefs as well too. And then also, again, this level of distrust, like, again, I thought my body could do this, and then look at what I'm now having to, whether it's, pelvic pain, or dealing with, really painful scar, incontinence issues, so then with the body not wanting to functioning in the way that they want it to, then that brings on that added layer as well too. So it can definitely cascade into bigger things for sure.
It's such
Yeah.
oh, please go ahead.
I just wanted to also touch on, I mean, like I've heard both of you, T and Haley, bring up trust, and it makes me think of the people that I work with who are experiencing loss post-abortion, and the sort of like distrust that they have for themselves, because especially for people who have had multiple abortions, of like, how could I have let myself do this again? And then this is what I wanted, but why do I feel bad? And there's just like this incongruence between the choice that was made and the feelings afterwards that lead to this deep feeling of like, can I trust myself? Did I make the right decision? Or do I trust how I feel now? Do I trust how I felt then? And of course, not everyone experiences loss when they've had an abortion, but I think that a lot of people do. And I think even just the simple like naming of it, that like, oh, I think what you're experiencing is loss, or there's grief there, can be this like kind of like life gets blown open in this way of like, I didn't like know. And then that's from my personal experience. Like I didn't know I was allowed to have those feelings because I chose an abortion, and then I chose it again. So it was like, I thought that was saved for other people, and like, but I was having those feelings, but I didn't name them. And as soon as someone named them for me, it blew me open. And so I think just, yeah, even sometimes helping people identify the feeling or what they're going through, because it's not always associated with abortion. There's, it's a little bit scarier for a lot of people to talk about, but also just wanted to pull in the post-abortion loss as well.
Yeah.
Yeah.
And I think like, there's sometimes it makes me think about like, what you're allowed to call grief. And there's this, a doula I was speaking with yesterday, called it like hierarchy of loss. And that we feel like, well, if a loss happened, if it was a chosen, abortion, or the loss happened at 5.5 weeks, this is very different than, a second trimester loss or stillbirth. And therefore they don't allow themselves they feel they're not allowed to grieve in that way, because there's been loss that's different, or it feels like weighted, or, so it's interesting of being able just to give someone, just to name it for them. And even if they wouldn't have identified that as a reason to grieve or whatever, but really just name it for them and allow them to feel it, even if it was defined differently in their mind.
I think even which I think is, the case for, some folks, but those who have had abortions, at a younger, period, or, time in their life, and then, where they're now more stable, whether it's like financially or, relationship wise, and then they're ready to try to conceive, and then they're struggling with, being able to conceive. I feel like that's also another sense of loss of, and probably guilt, as well too, that they were able to conceive at that time, but then they had chosen to, end the pregnancy for whatever reason. And now that they're struggling with being able to conceive and feeling guilt, around feeling like that they're being punished, for the choices that they made. And now they're having difficulty with being able to conceive, at a later time in their life, which is, I feel like, shouldn't be a guilt that they should be placing on themselves. And it's just like what the situation is, but also it would be interesting, like, whether they have not been able to really process, those abortions and those losses, and how that could be contributing to, what they're, experiencing at the moment.
Yeah.
Mm.
I want to go back just quickly to Tia, just and to mention like how, the medicine that you practice is so powerfully integrative of, touching on the physical and weaving in that emotional piece. And just to share a few minutes on how Chinese medicine is, because it's also a physical medicine, it kind of acts in the some, like there's some overlap, but there's definitely differences in that too. In that, Haley had mentioned earlier, from a midwife's perspective, a loss is treated very similarly to a postpartum. And that's certainly true from a Chinese medicine lens. Even if you look at it just physically, like there's an immediate at once, loss of blood and what we call qi, there's this drop in hormones. And so the body really, what it needs is this revival to, nourish the blood and warm the body and recover the energy so that the patient can then, just recover physically as well as mentally feeling more stable as well. And so therapeutic recommendations would be very, very similar to a postpartum period where, again, like building the blood back up, warming the body, warming the meridians. We look a lot at, not just the needles, but the herbal therapies and nutrition, and really trying to balance this in a way of helping we do this a lot with the needles, I would say, is like helping those feelings emerge rather than being suppressed. So we're not at all therapists at all, and that's not our scope, but it is like a medicine that helps things transform into what they need to be, not to tell the patient what they need to do, but just like allow that qi to flow very freely. And I just want to speak to like having experience working with each of you in this space, like how powerful, like the medicine that I practice is powerful. And it doesn't do what it can't go to a space that somebody needs to, from like what Kristen offers, or even being transitioned from Haley or working with Tia alongside. Like it's, I just keep going back to like, why isn't this care provided for everybody? And maybe it's not always, appropriate for every single one of these modalities, but I have seen it in real life. I have seen it just how we work together and what that brings for the patient, and they feel just so respected and that they deserve this and that they can actually feel like they can move into what it is they need to move into. But I want to spend a few more minutes with what we were talking about in terms of like, Haley, I think you said, this is kind of a discussion for people that are supporting others, right? And often we're just so fearful ourselves for touching that because we want to see our friend or our sister or whoever to just like move forward and be happy. And that's not their job, right? It can be hurtful if we don't really allow that space, that deliberate space to just be. And I just open it up to each of you, like in terms of what does it look like for you? What are your recommendations in terms of what people can do for a loss without being prescriptive, but really just like from a human perspective?
I mean, for me, like I would say the biggest is just to, whoever it is that's supporting the person who has had a loss, is just to be able to be present and to just listen. I feel like it's very easy for some folks to say like, let me know if you need help, but, to actually be able to be very concrete in regards to what help you are going to offer, whether it's, I'm going to cook, a couple of meals for you and I'll bring it over, or especially if they have other kids, as well. And then they're also having to deal with that loss. Like, let me, I'll come over and I'll babysit, and I'll, play with your kids for a couple of hours so that way you have some time, for yourself to take care of yourself. Just offering to I feel like it very similar as if someone postpartum, you would come over hopefully and actually help, you would do some of the household stuff. You would take care of the kids. You would, cook a meal. Just do some of those things. I think it should be the same thing, that, when you are wanting to offer support, like have it be concrete, just be there to listen. I think sometimes, again, people will want to try to fix and, wanting to say the right things. There is no right thing to say. There isn't. So even if it's just like quiet space, like I think then that allows that person just to kind of feel their feels and just say what they want to say and just let them speak. And you just are a soundboard and just to allow, just to be there to listen. I think that's the biggest that a lot of people need and that a lot of people don't get.
Beautiful. I would say to keep checking in 3 months later, 6 months later, a year later, and check in specifically around the loss, not just like a how are you doing, but if I think it can feel scary to like want to like bring things up, but in my experience, it feels really good to be checked in on specifically about my abortions or like, and to do it for other people, because sometimes you go months without anybody naming it and you're just kind of like in your own little thing about it and it becomes like invisible and almost like it didn't happen. And then the moment someone kind of like speaks the word to you, like, how was your loss? Like, how was your pregnancy loss? It kind of like brings it into focus. And I think is just an opportunity to hear something interesting about your friend, about how are they doing? What have they learned? Where are they with this process? What's coming up for them? What do they see for the future? And it doesn't always have to be like a, a heavy thing. It could also be like, oh, wow, like actually I'm doing this and now I'm seeing this about myself. So I don't know, just keep going, keep asking.
Yeah. Yeah, I would say too, I mean, kind of piggybacking on what already has been said, but for the person who has somebody in their lives that is going through this, when there is that discomfort of like, oh, so-and-so went through this, I'm going to give them space, pause and think about that and ask yourself, like, what is that discomfort? Because it really, if you do flip it a little bit, it is an opportunity for that person to really learn about themselves if they just lean in even a little bit, and start with a text or start with, a brief visit. And yes, it can be uncomfortable. It doesn't have to be, but even if it is, like, what is that? And sort of going back to what Kristen had been talking about before, like this is somebody who has touched something that perhaps you don't have that experience, and you will at some point. We all touch grief in some way, or we all touch loss. And so sort of just like trying to like move through this fear of what is inevitable, that we will touch it in some way.
Yeah, I think so much of everything of like checking in and especially the helpful things for afterwards, especially because that person is most likely having to function in like the day to day at work and not have that time and space for themselves. And so dropping off meals, comfort items of pads, of Advil, of Arnica, of like oils, of things that make that person feel loved and nourished and nurtured, and even going, just pointing them maybe in the direction of some care providers that you think may be helpful, especially if the loss is in the second trimester, of having them speak, like saying, hey, I got you a consult with a lactation consultant as to how to bind your breast and stop milk supply, and naming that for that person, I think can be really helpful, of like, oh, right, there's that piece as well. And it just makes it real, and that it's a real loss at any point. And or booking them like some kind of body work and say, if and when you're ready for it, it's there. And I think just kind of that showing up of offering things that really are healing, but also can be much smaller little ways of like of just showing that you love them and you're there to support them, and whatever it may be, from just dropping off some pads to yeah, sitting with them for a little bit.
Every gesture counts for sure.
Mhm.
Okay, I want to thank you all so much. This is really such a powerful discussion. Thank you for all that you're doing to support your patients. And we'll go ahead and close the conversation.
Thank
Thank
you.
you.
Oh, I'm trying to figure out how to stop recording.
Yeah.
Sorry, guys, I was really humbly.
The outtakes.
Dying.